In this video we will discuss about the anatomy of the elbow. So the elbow consists of three bones. The humerus, which is this bone that we see here in this 3D model, and this is the posterior part or back part of the elbow. And then we have the radius, which is on the outside part of the elbow, and the ulna, which is on the inside part of the elbow. If we look closely at the elbow joint, there is very little space between the humerus, the ulna, and the radius. These are the three bones that are involved in the elbow joint. So fractures of the elbow can involve the supracondylar region of the humerus, which is above the condyles, and condyles are these structures that you see here that I demonstrate on this animation. It can be a fracture that extends into the joint, either on the inside part of the elbow or the outside part of the elbow, or it can be a fracture that results in multiple fragments within the elbow joint. There's also fractures that involve a structure in the back part of the elbow known as the olecranon. The olecranon is a prominent bone that you can feel in the back of your elbow. Fractures of the coronoid process are fractures of this structure that you see here, and those can be associated with instability or can be isolated. We can have fractures of the capitellum, as you see in this case, where the ball of the elbow has been sheared off and is anteriorly dislocated and displaced. We can have fractures of the radial head, as you see here, which is on the outside part of the elbow. We can also have fractures of the condyle or the epicondyle on the outside part of the elbow or lateral aspect of the elbow. There's also combinations of these fractures in all possible configurations. There is a special fracture around the elbow which is called the Monteggia fracture, and what happens in this case is the fracture goes through this area here on the ulna. There is angulation of this bone, and there's also a possible dislocation of the radius, which is the bone on the outside part of the elbow. So this is essential fracture dislocation of the elbow that usually does require surgery for definitive treatment. So the elbow joint behaves more like a hinged joint, and it's a joint that has a tendency to develop stiffness after trauma.